Hello, everyone. My name is Jessica Porras, and I'm the Senior Manager for Education and Outreach at CAQH CORE. It's my pleasure to welcome you to our fifth webinar in the series on electronic healthcare attachments. Today's webinar will showcase Vyn's use of electronic dental claims attachments. I'd like to mention a few logistical items. You will be able to download a copy of today's presentation from the CAQH.org website tomorrow. Also, a copy of the slides and webinar recording will be emailed to you in the next day or so. Just to clarify, the slides are not on the website right now, but they will be tomorrow. We will save time at the end of today's program to respond to your questions. I encourage you to submit your questions at any time during the webinar by typing them into the questions panel on your dashboard. You can see the webinar agenda on this slide. We will start off with an overview of CAQH CORE's work on attachments. Then we will move on with our case study and have a representative from Vyn sharing information about their dental attachments product called Fast Attach, as well as a customer who will share his experience and challenges with electronic dental attachments, as well as Fast Attach. And of course, we'll save time for Q&A. We would like to thank our guest speakers for being with us today. Nicole Smith, Vice President of Payer and Partner Services at Vyn Corp., and Philip Sokoloff, who is the CIO and Vice President for Revenue Cycle Management for the Southern Dental Alliance. So let's get started with our first presenter, Core Manager, Taha Anjarwalla. Taha?
Thank you for the introduction, Jessica. And I'm very excited to talk to you today about kind of Core's work with attachments and provide you some early insights into our initial findings on our environmental scan efforts. So before I begin, I'd just like to provide everyone with the background on CAQH CORE. So almost a decade ago, CAQH established the Committee on Operating Rules for Information Exchange, also known as CAQH CORE. And CORE is an industry-wide stakeholder collaboration committed to the development and adoption of national operating rules for the administrative transactions. CORE's approach towards operating rules is holistic and an integrated approach, starting from a staged process of rule development, which involves an in-depth research on potential rule areas, to bringing industry minds together to develop and collaborate and vote on requirements for key operating rule areas. CORE then promotes operating rules by building awareness through education, and then we also offer a certification program for organizations to test for and demonstrate compliance where adoption can then be tracked. And lastly, we continue to monitor industry needs for future rule development areas and requests for updates to existing rules. And apart from all of this, CORE has its own governing board of directors with representation from providers, vendors, clearinghouse, payers, associations, and regulators. And kind of looking in relationship to this, in relation to today's presentation, CAQH CORE is at the very beginning stages of rule developing in terms of attachments, and that we are currently working on research efforts and also building awareness to the industry by educating industry on some of our attachment findings. So on the next slide, to date, CAQH CORE has developed 4 phases of operating rules and serves as the HHS designated operating rule author for all HIPAA-covered transactions. These operating rules support standards and then specify business actions that each party must adhere to in order to ensure a high volume of reliable transactions that can occur smoothly and which result in a great deal of cost savings to providers and health plans who implement operating rules and their underlying standards. You can see some of these estimated cost savings below, provided by the 2017 CAQH Index for each transaction type, highlighting the estimated savings by switching from manual business processes to an fully electronic automated EDI process. In phase 1, we focused on the eligibility transaction, and in phase 2, we extended the operating rule requirements for eligibility and added operating rules for claim status. And in phase 3, we have rule requirements around the EFT and ERA transactions, and moving into phase 4, we built key infrastructure rules to support the healthcare claims transaction, which covers the professional, dental, and institutional claims, the prior authorization transaction, the enrollment and disenrollment transaction, and the health plan premium payment transaction. All in all, this entire suite of operating rules support the HIPAA-mandated transactions that trading partners should use between health plans, providers, clearinghouses, and vendors. And that CAQH CORE's designation as the operating rule author allows us to draft operating rules for these current transactions, as well as for future mandated transactions, such as the attachment standard when mandated. On the next slide, the CAQH index is the industry source for tracking health plan and provider adoption of fully electronic administrative transactions. Tracking adoption and cost-saving opportunity is essential for assessing the progress and momentum of ongoing industry transition from manual to electronic processes. Looking at by benchmarking progress, industry and government can more easily identify barriers that may be preventing stakeholders from realizing the full benefit of electronic and administrative transactions. And these insights can then prompt new initiatives and ways to reduce some of these barriers. And looking at how this relates to some of the attachments, in 2017, CAQH Index tracked both the use of the X12-275 transaction and the HL7 CDA for claims attachments, and by medical plans across looking at over 47 million claim attachment submissions. And in looking at an evaluation of these findings, we found that only 6% were sent electronically using the X12-275 transaction, and there was no findings that the HL7 standard for claim HL7 standard for claim attachment was reported to be used. A majority of stakeholders additionally reported that the claim attachments were submitted through manual processes such as mail or fax. So that was mail and fax are the primary methods kind of used by most stakeholders today for the attachment transaction. So on the next slide, we've been looking at comparing 2016 versus 2017 adoption rates for various transactions that were tracked by the CAQH index for the dental industry. We can find, as you can see, claim submission and eligibility inquiries have the highest adoption rate when compared to the utilization of EFT ERA for payments. And I'd like to note that the CAQH index did not report metrics for claim attachments for the dental industry, as the dental sample size for this particular transaction was too low. So if your organization would like to contribute to the index, let us know, and we'd be happy to follow up, as this is a very valuable report to the industry, and it helps provide kind of cost savings and adoption, for the industry at large and estimated cost savings at whole. So let us know if you'd like to contribute to the index report. On the next slide, comparing the dental industry to the medical industry, you can see on this slide, adoption of fully electronic transactions by dental plans and providers has increased slightly for some of the transactions, but on average is 30% points lower than the medical. The medical industry shares similar trends, though, with the dental industry, with claim submission and eligibility inquiries being the highest adopted transaction, and claim payment and remittance falling behind. And as mentioned earlier, there's approximately 6% adoption by the medical industry for electronic claims attachments. So on the next slide, I'd like to kind of provide some context on some of the upcoming HHS activity. So although there is no current HIPAA standard for electronic attachments, we find the industry is moving forward towards building approaches to drive adoption of electronic attachments. In relation to an attachment standard, there's upcoming HHS activity as identified by the Spring 2018 Unified Agenda, which is a semi-annual publication that the federal government releases outlining upcoming regulations. That a proposed rule for an attachment standard is expected to be released in August 2018. In addition to an attachment standard, the Unified Agenda also indicated that an acknowledgement transaction standard for HIPAA-mandated transactions would be adopted, and the version 6020 of the X12-278, which is the prior authorization transaction, may be adopted as well from the current mandated version 5010 version of the standard. In preparation for future operating rule development related to attachments, CAQH CORE has remained actively engaged in the attachment space through surveys on the current state, industry tracking, education, and its ongoing environmental scan efforts, given its HHS designation as the operating rule author. So on the next slide, now that we've set the stage with some common facts and key metrics on the industry utilization of electronic attachment standards, noted by kind of low adoption rates and the lack of a mandated attachment standard, I'd like to introduce and focus the rest of the discussion on CAQH CORE's efforts to propel the industry forward to a more electronic attachment process optimized by automation which hopefully will reduce some of the burden on providers and health plans, help speed up the revenue cycle, and importantly, improve timely delivery of patient care. So on the next slide, I'd like to kind of provide you an overview of the scope of work to date. So to date, CORE has engaged in a variety of work efforts to survey industry engagement and involvement in the electronic attachment space, captured through its environmental scan. So research and planning phases of our environmental scan are completed, where we have surveyed and engaged a variety of industry efforts related to attachments from work groups, conferences, regulatory activities, participation in some of the external groups such as WEDI and HL7. And further, CAQH has developed an interview guide tool to survey key stakeholders on their attachment efforts across key opportunity areas such as business needs, data content, and infrastructure components. And currently, we are working to complete our organizational interviews to understand key trends, best practices, and challenges related to adoption of electronic attachments. These interviews will help to identify areas where CORE can help to build on and to move the industry forward with electronic attachment adoption. Further, CAQH CORE is committed to hosting education events like this one to inform and educate the industry on current attachment trends and news. And looking forward, after our attachment environmental scan efforts are completed per the operating rule development process that I highlighted earlier, CORE plans to launch an attachment advisory group to review key findings from our environmental scan, which will help us prioritize some opportunity areas that hopefully a CORE subgroup can then work on to really define and develop potential operating rules for attachments on. So on the next slide, I'd like to kind of highlight some of our key milestones and timeline for some of these activities. I've indicated that we completed our research and planning, and currently we are in our environmental scan phase process. And then looking forward, we're in the fall of this year, we hopefully will look to launch an advisory group, and then sometime starting in 2019, hope to then launch the subgroup that I discussed. And then now I'd like to, on the next slide, kind of give everyone a perspective on some of our outreach efforts and kind of engagement in our environmental scan to date. So as you can see, there's been a lot of interest in the industry in terms of engagement and participation in our environmental scan. We've engaged with over 125 plus organizations and included a variety of different stakeholders, including health plans, providers, vendors, clearinghouses, government agencies. So far, we've completed about 29 interviews, and we have 7 more scheduled, which are scheduled to occur over the next 2 weeks. If your organization is interested in participating in our environmental scan, please let us know, and we'd be happy to discuss how you can be involved. So with that, I'd like to kind of provide, on the next slide, provide an overview of what sort of scope our environmental scan and kind of what are some of the key topics that we've discussed. So looking at attachment profiles, with this, we're learning what are some of the primary methods of how organizations and stakeholders are sending attachments, whether it's through mail, fax, web portal, and across all the different sort of business transactions, looking at not just claim attachments, but looking at prior authorization, looking at referrals, looking at the grievance and appeals process. So just learning some insight across how documentation and attachments are processed then. On looking at volume and resources, this is information that we're looking to collect on how attachments are processed, and looking at the staffing time involved and some of the resources involved to manage that collection of additional information. And looking at some of the business needs, with this section, we're actually looking to learn about how, what sort of business requirements are there in sort of, adoption towards electronics. So looking at, requirements, between unsolicited attachments versus solicited attachments. And the data content section, we're actually diving more into the technical aspect of how attachments are exchanged. So looking at data file types, data structure, and metadata elements. And looking at infrastructure, this is kind of related to learning how, if for those organizations that are sending things electronically, learning, are acknowledgements being sent, or, are there any security controls that exist? And lastly, with adoption barriers, we're looking to learn, how organizations are, implementing attachments, are they doing it today, without the mandate? Are there any pilots going on? And looking at sort of any sort of implementation timeframes, for when the standard is federally mandated. So with that, I like to kind of share some of our early insights and findings. So with some of our attachments and looking at attachment profiles, we found, and this has kind of been validated by the index, is that primarily attachments today are being sent via mail and fax. and EDI submission is very low, and we've received reports from providers that adoption is low because there's minimal support and adoption by health plans and practice management vendors to support EDI attachments. And then looking at some of the time and resources involved to manage the processing of attachments, we've learned that, from providers that on average it takes about 55 days via mail, 22.5 days via fax, and 7 days via a web portal for a health plan to adjudicate a claim with an attachment. And then looking at some of the business aspects of attachment, but we've learned that majority of stakeholders are requesting that the end goal would be a real-time scenario for solicited attachments to help adjudicate a claim or prior authorization request. And a lot of providers have also expressed that for them to convert over to a more electronic format, they would want more defined requirements from payers on what some of those unsolicited attachments may be. So on the next slide, we find, in looking at some of the data content aspects, that a majority of the common electronic attachment formats being exchanged today include PDF and image files. And looking at what the future desired state may be, health plans and vendors have expressed that structured attachment standards such as the HL7 CDA would be preferred. In terms of infrastructure, most organizations have indicated that the use of acknowledgement should be addressed so that stakeholders are aware when an attachment is received. And also, lots of stakeholders have expressed operating rules could be beneficial, such as connectivity and security and response time, so that attachment transactions are sent in a secure manner, and that acknowledgements are being adhered to. And lastly, in looking at adoption, we find that there is a mixed sense in that some organizations are ready to implement the attachment standard, versus others want to wait until a standard is federally mandated, as they don't want to make the investment. But however, in light of all this, we're finding that most organizations have at least launched a pilot program testing a variety of different protocols for attachments, including the 275, direct messaging, HL7, and clinical data repositories. So those are some of the key early findings, and if you'd like to participate in an environmental scan, feel free to reach out. So on the next slide, I'd just like to point out we've done a lot of education around attachments, so you can refer back to some of our education theories, and some of these are technical, and some of them will give you a broad overview of attachments today. And lastly, on the next slide, this is just a variety of ways that you can engage with CAQH CORE and be part of some of our attachment efforts. And again, I have talked about an environmental scan, and talked about later this year, we're hoping to launch an advisory group, and then in 2019, we'll hope to launch a subgroup. So hopefully, there are a variety of ways you can engage with us, and let us know if you're interested in any of these sort of activities and work efforts. And with that, I'll turn it over to Jessica for the next slide.
Thank you, Taha. And you set up what I'm going to be talking about perfectly. So on the next slide, let's go ahead and launch a poll. We'd like to hear a little bit from our audience. I know that Taha just talked about our environmental scan and ways to engage with us. So in this question, if you're interested in participating in the environmental scan, feel free to respond to this poll, and we will contact you because we do want as much dental engagement as possible. So I'm going to leave this poll open for just a few more seconds, and I'm not going to share the numbers, but I will say that I'm really happy to see that a lot of people are interested in participating, and we will follow up with you shortly. So let's go ahead and close the poll. Thank you. And with that, I'd like to welcome our speaker, Nicole Smith from Vine Corp. Nicole, thank you so much for joining us today.
Thank you for having me, Jessica, and welcome everyone. Again, my name is Nicole Smith. I am the Vice President of Payer and Partner Services at Vine and NEA Powered by Vine. And I know we've talked a lot about industry standardization. And today I'd like to talk about, while we wait on the industry to move toward that standardization, I would like to talk a little about the solution we have in the market and how we address attachments specifically in the dental industry today. So on the next slide here, I'll just give you just a little bit of background about our company, Vine. Vine is an industry leader in secure information exchange and electronic healthcare communication management. We have a technology platform that facilitates the electronic capture, storage, and submission of healthcare data. And that can be in any form. It can be voice, fax, image, data, or an electronic document. Vine is composed of two business units. We have Vine Medical and NEA, both addressing the dental and medical markets. Today we're going to focus on NEA powered by Vine, which is our dental segment. For over 20 years, we have been providing electronic attachment solutions in the dental industry. Currently, today, we are partnered with over 55,000 dental practices and over 750 health plans. So we're successfully and securely exchanging electronic attachments with over those 55,000 dental practices and over 750 health plans. And we process about 3 million images per month through our electronic attachment solution. So on the next slide, we'll see NEA powered by Vine is really working to bring collaboration between providers, payers, and channel partners. We're working to increase the submission of electronic claims while reducing those paper and manual-based processes. So all manual-based and paper-based processes can be eliminated with an electronic solution. And transitioning over to the next slide, again, you'll see we've been providing these solutions in the market for 20 years. And collaboratively, we are working with health plans and payers to produce better financial outcomes. We're delivering greater operational efficiency and compliance. So our electronic attachment solutions, they are going to reduce expenses related to paper-based workflows by facilitating that flow of information. Our providers and payers both experience streamlined claim adjudication processes as well as improvements with their practice revenue cycles. We like to really promote the electronic submission of claims and further eliminating those paper-based and manual workflows. One of the benefits of our solution is the provider can continue to use their existing practice management system or their claims clearinghouse. Our solution is compatible with all practice management systems and claims clearinghouses. And by using an electronic solution, they're able to reduce the number of pending and denied claims and increase those auto adjudication rates. Specifically for payers, our solution also enables third-party sharing and review. So should a payer be consulting with an outside agency and they need to send dental claims and attachments over to that agency, they can facilitate that secure exchange electronically with our solution platform. And that's really going to help a payer to reduce claims overpayments by being able to identify improper procedures and deterring fraud and waste with the electronic attachment requirements. And on our next slide, we have just a quick study on the costs associated with submitting a paper attachment. And this is based on our empirical research. If an average dental office sends just over 4,400 claims annually, and they're submitting an attachment, either a solicited or an unsolicited attachment, for that 50% of those claims, all the costs factored into the work and the materials that are involved with those paper and manual-based processes will cost a single dental practice just over $24,000. Whereas if that same dental practice were to implement an electronic solution for their attachments, the annual cost is going to be just under $2,000. So you see there's significant savings involved in time, labor, efficiency with electronic solutions. So again, just trying to shift the industry towards the electronic route. And so the solution on the next slide we'll see here, on the solution that we've developed to address the attachment problem in the dental industry is called Fast Attach. And we'll take a look at that solution here in just a moment. Fast Attach is a HITRUST certified software application that enables the secure capture and transmission of dental images from either a provider to payer or from a provider to provider for a referral, for example. Again, I mentioned Fast Attach is compatible with all practice management systems and claims clearinghouses, and it has features that are suitable for a single doctor practice, a multi-specialty clinic, the dental university, or large multi-office dental service organization. So dental offices or practitioners of all sizes can use the Fast Attach application and easily incorporate it into their workflow. With Fast Attach, a provider can submit x-rays, perio charts, explanations of benefits, narratives, pre-treatment estimates, secondary insurance information, really any documentation that a payer is going to require to adjudicate a dental claim. So this solution can be used to facilitate that secure exchange of that information. Additionally, Fast Attach has a special feature built into it. It's essentially a payer attachment requirement rules engine. It's called Fast Look, and it displays payer-specific attachment requirements by procedure code. So it eliminates that guesswork on what needs to be sent up front during the initial claim submission. The provider can query this database of rules by payer and determine what they need to submit with that electronic attachment. If they are using one of our interface solutions with either a practice management system or a claims clearinghouse, it's going to automatically query those codes on that claim and notify the provider of what attachment needs to be sent up front prior to submitting that claim electronically. So again, just improving the overall revenue cycle of the claim and increasing those first pass rates of that claim. And that Fast Attach database is available 24 hours a day, 7 days a week. So it's available all times, and it is a feature inclusive in the Fast Attach application. And so if we get to the next slide here, I'm just going to show you a quick demo of Fast Attach, because sometimes a dental office may think that it's going to be a huge disruption to their workflow. I just want to show you the couple of steps that are necessary to successfully complete an electronic attachment submission. So here on my screen, you're seeing the main screen of the Fast Attach software application. To submit an electronic attachment, we're going to hit the new search button here in the upper left-hand corner. We just want to search for a patient. Once our patient appears, you just want to double-click, verify that all the information is correct, your payer that you're submitting the information for, and then click Create Attachment. That brings you to the Data Entry Image Acquire screen, and this is where the majority of the work takes place in the software application. This is where you're actually going to attach the documentation that needs to be sent to the payer organization. So on the screen, we have the patient's indexing information that we just verified on the previous screen. Should we be using a standalone application and not using one of our interface solutions, or we want to go out and check the requirements for this particular example is for Aetna, we'll just hit Check Requirements, and this is going to access our Fast Look database where we can look up the particular procedure that we're submitting the attachment for to determine what actually we need to submit. So on this screen here, we just want to scroll down and enter in our code. Hit search, and there you see this is a treatment of a root canal obstruction, and this requires a narrative and an x-ray. So again, this is just an extra step to eliminate that guesswork on alerting the provider on what they need to send up front with their claim submission. We just want to go back into our Fast Attach application and select the date of service of our claim. If there's a narrative that needs to be sent with this attachment, the provider can type that narrative directly in here in this box, or they can attach the narrative as an attachment here. Fast Attach does support solicited and unsolicited documentation. It automatically defaults to an unsolicited workflow. If this were in response to a request for information, we would simply click yes and enter in that payer reference number that was associated with our request from the payer. We're going to leave this on no, and now we're ready to upload our supporting documentation in this electronic attachment. So Fast Attach has various acquisition methods that you can use to get your images into the software application. Screen capture is one of our more widely used acquisition methods. You select screen capture, and let's just pull up an image here. Then you're just going to hit the little draw rectangle from our toolbox here in the upper right-hand corner. Anything that you outline imports over into our application for you. Now, Fast Attach does require that you select the date that the image was taken, and then you need to select an image type. So we'll just select that and hit Next. And there, that image has been included in our electronic attachment. If you have physical x-rays that you need to include in this attachment, you can, and you have a scanner hooked up to your workstation, you can launch that scanner by clicking this button here and scan it directly into your electronic response. File import lets you go out and browse on your system for the image that you would like to upload. You just double click. It's going to pull that image over into our image orientation. You just want to notate if it's on the patient's left side or right side, or you can also notate if the bubble is raised towards or against you or from you. Again, you want to select the date the image was taken and then select the image type. Hit Next. And there, that image has been included in here as well. Archive, we are storing all of these images for our providers, so anything that's been previously submitted for this patient, you can access that and include it in this electronic response as well. And then lastly, our image acquisition method is Fast Capture, which is a mobile app. It is patented technology available for an Apple or an Android device, and it's going to enable you to take a picture of an X-ray on a light box, and it will seamlessly import that image directly into your electronic attachment. Now, the benefit of the Fast Capture application is if that device is later lost or stolen, there are no remnants of that image or PHI on the device. The image is immediately imported into Fast Attach, so if that device is lost or stolen, there's not going to be any references to that image on the SIM card or the image gallery of the mobile device. So this Fast Capture actually eliminates the need for a dental office that is not using digital x-rays to have a scanner that has a transparency adapter. So that is a standard feature with our application as well. So once you've uploaded everything that you need to upload into your electronic attachment, you just want to save it. It takes us back to the main screen and we're showing a status of ready to send. So to send this attachment, we're just going to hit send. That immediately sends it to our secure repository. The provider is returned with this attachment submission report. In the attachment submission report, the attachment is assigned what we call an NEA number or an attachment tracking number, and that attachment tracking number is placed in the electronic claim. They then send their claim electronically as they normally would, and once the payer receives the claim, they are able to use this attachment control number to access the electronic attachments that are there to support that claim. So once you've gotten this report, you successfully submitted your attachment electronically, you can close that out and you're back on the main screen of Fast Attach. So as you see, I know I did a couple little extra explaining while I was walking through that demo, but it really is just a few steps to be able to securely capture and transmit your supporting documentation to a health plan. So with that, Jessica, thank you again, and I will turn it back over to you.
Thank you so much, Nicole. Thank you for walking us through the product. And now I'd like to introduce our next speaker, who is Philip Sokoloff. I've introduced him prior, but we'll introduce him again. He's a CEO and Vice President for Revenue Cycle Management for the Southern Dental Alliance, and we welcome you to this webinar.
Thank you, Jessica. I appreciate it, and I appreciate all the stakeholders being present for this and being part of the industry for so long. I'd like to ask everyone a key question, especially since I saw many clearinghouses and payer adjudication platforms listed on the survey of participants that are joining the conference. And ask yourself, why are providers incentivized through meaningful use and interoperability to enhance patient care, but clearinghouse and payers are lagging in automated transport and acceptance of the same records to streamline the care authorization and adjudication processes? And I know that's a complex question to ask, but I think everyone as key stakeholders needs to ask themselves, what can we do in order to improve and streamline the care management cycle for patients to ensure they receive the right care when needed, and that the adjudication cycle is simplified and reduce much of the frustration associated with the stakeholders that are delivering those records back to the payers, and give that feedback loop. In response to that, it's obviously recognized that we need to create standardized transaction sets. That's a key issue within the industry that we need to review. And in conjunction with that, please put up the next slide, that we all need to take a look at what's happening within the practice management solutions within dental and medical. I have an extensive background, probably 14, 15 years within dealing with dental PMs as well as medical. And one of the key areas that dental is actually ahead of medical is in the use of attachments, as is presented by Vine, which is previously NEA. I think one of the areas that payers and clearinghouses can look at is the development of tools that are practice management agnostic, so that either APIs can be developed to aggregate two tools like Vine, or they can build coding directly into their adjudication platforms that will accept these images that can be used for various sources. Right now, the key issues in the industry are obviously prior authorizations and the standards that are expected depending on the type of care to be delivered and the requirements of each of those payers under plan structures. Imaging evidence, which is either through direct dental imaging or through PACS platforms, and even standard X-ray images that can be scanned and uploaded to the various payers. We have clinical necessity narratives, which also combines with records. Right now in the dental segment, Vine as a platform will allow all of these items that I'm mentioning, and specifically more on the medical side, there's too much faxing that does not allow the skip tracing of items going back and forth, because there is no standard for email attachment transport or identification. And systems that are out there don't have a standard identifier for attachments except for snail mail. And then payers are dealing with the burdensome overhead of dealing with scanning departments, indexing of each of the fields associated with that, whether it be automated or manual, the maintenance to support the code that deals with benefit alignment, and everyone could be supported here if we could recognize the ROI by payers on their side, being able to streamline this process. It's not all about increased utilization by an improved process. A lot of this can be done by looking at what costs are being absorbed now with staffing overhead and automated processes, whereas a third-party solution or something embedded directly into the claim adjudication system would allow you to view images, classify them automatically through an indexing platform, and store them directly into a repository, and be able to recall them without all of the complexity involved. Additionally, you wouldn't have to have central management staff to do it, and you could have remote staffing that could manage all of these processes with clinical authorization from any site to view what's going on inside of your system. So in conjunction with that, we also have COB. On the medical side, it's not always essential to provide the actual EOB, but on the dental side, they tend to require the actual EOB that's received. Correspondence and remittance could be transported in the same value. I recognize certainly on the medical side, 835s and ERA conversion has a much higher acceptance rate than on the dental side, but there's no reason why correspondence couldn't have a bidirectional method in order to transport information back to a provider rather than using mail, which would save significant costs there. From a credentialing perspective, right now, you have CAQH, some other platforms that payers can use for universal credentialing, but this same platform could just as easily be used in order to identify a record that's being sent and indicate the credentialing document is being transported. So in the long term, I really see that a solution like Vine or dealing with internal platforms that deal with imaging and indexing of items can be used for a number of reasons, because unfortunately there's no indexing solution related to secure email that's out there. Next slide, please. This portion is going to focus more on the RCM side for providers. These are the areas really that they could see specifically in dental improved DSOs on each one of these types of items that could increase and reduce time between 15 and 30 days. Certainly from the use of Vine in the dental sector, which is integrated with the practice management companies and can be used external to it. You get expedited authorization of patient treatment, which is required in a number of complex procedures, and any type of record can be added through the system, transported to the current payers right now, and those that accept it can be done rather than mailing it out, because everyone knows you can't send a fax that has x-rays on it because of the DPI resolution. Clean claim adjudication is also improved. There are a number of procedures within dental that require x-rays and or records to be submitted along with the treatment in order for it to be approved as part of clinical necessity that's not necessarily authorization. Resubmission turnaround, when a requirement is asked of a payer, certainly there are options in order to add records, add correspondence, add items out of the clinical record that it can improve that. And in offices that are not using this, it is a very simple ROI equation. The cost to use a solution like Vine is easily justified with one or two claims that go through the time, work, and effort of your staff in order to use it. It's a simple workflow, can be added as a solution, and there's no need to do all the mailing that's out there and slow down the claims process. Once again, reducing your mailing costs and the use of fax and workflow in the offices. And the one thing that I think is of greatest benefit is document transport assistant or skip tracing. Right now, unless a clearinghouse is offering an attachment and drop to paper solution that is validating receipt and transport to the payers, no one in the industry, whether it be dental or medical, is sending authorizations, attachments, and so forth via mail and adding a signature requirement when it's sent to it, because most of them go to a PO box or processing. So in this case, when you're using a secure transport solution, you can see from the point of submission through the point of acceptance what's happening to that document. And for appeal purposes, for verification both from the provider and the payer, you have documentation that proves that that was sent when and how it was accepted in that process. So I really think here are the benefits to utilization in the industry, and the industry will be well served to adopt either a third-party option or rapid acceptance of 275 transaction sets to some method so that we can expedite attachments in some form, both in dental and medical, as a standard process. Thank you very much for the time to speak to the audience.
Thank you so much, Phil, for your presentation. We really appreciate it. It was great to walk through the challenges and the benefits and with your perspective as a user. So thank you very much. And now we have our next polling question. So we've been talking about, the fact that the electronic transactions, standard electronic transactions aren't being used, and we want to get a feedback from you as to what the challenges are. What are your main challenges? So let's go ahead and launch this poll, and it's a check all that applies. So feel free to click on more than one, or if you have your own unique challenge, please click other, and if you could, in the questions panel, add some, explain what your challenge is, that would be really helpful. We will be sharing the results, but this is also information that's really helpful for us as we do our research and our work on operating rules for claims attachments. So let's go ahead and share the response with the audience. I think it is interesting that the first two options are the ones that seem to be the most significant challenges for our audience. So I want to ask you, Taha, is this in line with what you were expecting, or
Yeah, exactly. So it looks like 64% are waiting on regulatory direction versus 52% are waiting on industry direction. So I think that aligns with some of the mixed sense that we've been hearing from some of our during our environmental scan interviews, and that some are kind of waiting to see as an industry and collection as a whole, kind of what what standards and formats organizations are converging around, whether it's the 275 or whether it's kind of in an HL7 CDA. So I think that's one part versus some of the organizations that are kind of more so waiting on regulatory. I think looking at some of the budgetary constraints and the high implementation costs are not wanting to move forward with making those big investments unless they have, because they have to do it once, because if they have to do, there's another standard that may exist than what they've implemented, then it's a high cost and burden for that. So I think it's kind of in line with what we are seeing, but I think if the industry as a whole can move forward and converge around one, I think that will help kind of align with hopefully a regulatory decision.
Thank you, Taha. And for the 8% of you who wrote other, it'd be great for you to add more information on the comments part of the platform for our own education. And now we do have time for Q&A. I'd like to remind you to please submit your questions by typing into the questions panel on the dashboard, the same panel that you would type in if you typed other in the last poll. So let's get started. We have received a couple questions. The first question is for you, Taha. The question is, if I model my safe harbor after phase 4 Core 470, am I compliant under HIPAA, or must I model after the phase 2 Core 270?
That's a really great question. So it's kind of a two-part answer. So with phase 2 connectivity, you have the option to use the digital certificates or use them in password. And with phase 4, it converges into a single authentication method, which is the XSAT 509 digital certificate. So in order to be compliant under HIPAA, because the phases 1 through 3 operating rules are mandated, and some of those safe harbor connectivity requirements would be to use that phase 2 connectivity and then converging around more the XSAT 509 certificate. So that will help you leverage some of the phase 4 connectivity standards, as well as kind of build and implement those phases later on.
Thank you, Taha. And we did receive another question for you. The question is about FHIR. So the question is, we've been hearing a lot about FHIR lately. Could you give us some background as to why it's important?
Sure thing. So first of all, just to level set and educate everyone in the audience what FHIR is. FHIR stands for the Fast Healthcare Interoperability Resource, and FHIR is a draft data standard developed by HL7, which is a standard organization. And FHIR was created with the complexity of healthcare in mind, and it takes kind of a more modern internet-based approach in connecting kind of different data sources and elements together. And it essentially is built around an API approach in which FHIR provides an alternative to more so your traditional document-centric approach by directly exposing data elements as services for real-time access. And for example, basic elements such as in healthcare, such as patient name, admission data, diagnostic reports, clinical information can be easily retrieved and manipulated via their own kind of resources, or if you think in the terms of kind of your web kind of URLs. And using kind of that standardized application interface, those APIs, FHIR kind of allows developers create apps that can then transcend this kind of document-based environment. So think of this as, in your mobile phone, you have this app-based ecosystem to easily pull data from a variety of different sources. So applications can then be plugged into kind of, electronic health records, into dental systems, and you can actually feed that information directly into provider workflows. So that way it helps alleviate some of the burden on, that document-based exchange, which, oftentimes providers will then have to, access data separately. So FHIR kind of helps enable some of that real-time access.
Great. That was very helpful. Thank you so much. So let's go on to the next slide. So on this slide, we have information about our upcoming presentations and webinars. If you will be at the WEDI Summer Forum next week in Chicago, we look forward to seeing you there. And then on the next slide, we'd like to thank our speakers and our audience for being with us today. And if you do have any questions or want any information about our work and our programs, feel free to check out our website or email us at core@caqh.org. Have a great rest of your day.